Welcome. Today, we're diving into one of the most incredible public health stories of our time, India's massive, coordinated war against a disease that has disabled millions.
Just look at this number, 40 million. Let that really sink in for a second.
That's how many people around the globe have had their lives completely turned upside down by a condition that is, believe it or not, entirely preventable. This isn't just some statistic, it's a story of incredible human suffering.
So, what is this hidden epidemic? And maybe more importantly, how is a single nation, one with more than 600 million people at risk, fighting back on an unprecedented scale? Well, that's exactly what we're going to unpack.
Okay, so before we can even get to the solution, we have to understand the problem. And we have to grasp just how cruel this disease really is. All right, so the official name is lymphatic filariasis, or LF for short. At its core, it's a parasitic disease. You've got these tiny microscopic worms that get passed from person to person through mosquito bites. And these worms, they set up shop in our lymphatic system, the body's essential drainage network that helps us fight off infections. They get in there and just wreak havoc.
And over time, all that damage leads to the disease's most notorious and devastating outcome, elephantiasis. We're talking about a severe, painful swelling, usually in the legs and genitals, that's irreversible and profoundly disfiguring. The physical pain is just immense, but honestly, the social cost, the stigma, the isolation, the inability to work, that can be just as crippling.
To defeat an enemy, you first have to understand it. So how does this tiny little parasite manage to cause so much damage? Well, it's all about its life cycle.
It is a truly relentless cycle. It all starts when an infected mosquito bites someone, injecting these little worm larvae. Those larvae then grow into adult worms inside the person's lymphatic system, where they can live for years producing millions and millions of microscopic offspring. These tiny baby worms then circulate in the person's blood, just waiting for the next mosquito to come along, take a bite, and carry the infection to somebody new. It's this vicious, self-perpetuating loop that is just incredibly difficult to break.
So that's the big question, right? How on earth do you break a cycle like that, especially in a country with literally hundreds of millions of people at risk? Well, you need a plan that's clear, massive, and tackles the problem from multiple angles.
And India's approach is actually brilliant in its simplicity. It all rests on two powerful common-sense pillars. First, Pillar 1, stop the parasite from spreading in the first place. And second, Pillar 2, help the millions of people who are already living with the disease. It's a strategy that attacks the problem from both ends.
Let's dig into that first pillar, stopping transmission, because this is where the sheer scale of this whole operation becomes absolutely breathtaking.
The heart of the strategy is something called mass drug administration, or MDA. The idea sounds simple, but the logistics are just staggering. Once a year, health workers try to give a combination of anti-parasite drugs to every single eligible person in the areas where this disease is common. What this does is it kills off those microscopic worms in people's blood, which basically makes it impossible for mosquitoes to pick up the infection and pass it on.
So how in the world do you manage that for millions and millions of people? You make it ridiculously simple. This dosage chart isn't based on someone's weight or complex calculations. Nope, it's just based on their age. A health worker can take one look at a person, figure out their age group, and know exactly what pills to hand them. It's that kind of operational simplicity that makes a gigantic campaign like this actually possible on the ground.
But here's the catch. For this to really work, it has to be a massive community effort. The target is to get more than 85% of the population to take the pills every single year for at least 5 years straight. So why that specific number? Well, it's all about creating a kind of herd immunity, but against the parasite. If you treat enough people, there are so few parasites left circulating that mosquitoes just don't have a chance to pick them up. And that's how you finally break the cycle of transmission.
So the pill campaign, that's all about protecting the future. But what about the millions of people who are already suffering? Well, that brings us to that crucial second pillar, managing the aftermath. For people who already have lymphedema, that chronic, painful swelling, the drugs can't reverse the damage that's been done. But, and this is a huge but, that does not mean nothing can be done. The focus here shifts to empowerment. It's about teaching people simple, home-based care techniques that can totally transform their quality of life, prevent these agonizing infections, and stop the swelling from getting any worse. And the steps themselves are so simple, but they're incredibly effective. It starts with just basic hygiene, washing and drying the limb every single day to keep infections out.
then elevating the limb to help with drainage, and doing some simple exercises to keep the fluid moving. We're not talking about high-tech, expensive treatments here. These are powerful actions that patients can do for themselves, which restores a sense of dignity and control.
And this really brings us to the final and most important point of all. Whether it's convincing your neighbor to take that annual pill or helping a family member with their daily limb care, this whole battle comes down to community participation. It's not just some government program, it's a social movement. It's millions of people making a collective decision to look out for each other, proving that even the most daunting health challenges can be beaten when everyone, and I mean everyone, works together.